Hi, I'm Justin Mistovich, a Pediatric Orthopaedic Surgeon at MetroHealth, and my clinical and research interests include sports medicine and arthroscopic surgery in the young athlete, spinal deformities in children, and the optimal management of pediatric fractures. In addition to my clinical work, I also serve as a program director for our Pediatric Orthopaedic Surgery Fellowship. Today, let's spend some time learning about ACL injuries in the young athlete. The ACL, or anterior cruciate ligament, is a critical structure in our knee joints that provides stability to the knee, particularly during cutting or pivoting sports. The rate of ACL tears in pediatric and adolescent patients continues to increase each year. There's one large analysis that found an increase of 2% annually over the last 20 years. Some of these injuries may be preventable through better strengthening and conditioning, avoiding playing during overuse and fatigue conditions, and also through focused work on improving balance. Nonetheless, even our most gifted young athletes can suffer an ACL tear. Unfortunately, once torn, the ACL does not heal. While there are some ongoing trials to attempt ACL repair, the current standard treatment is to build a new ACL through an outpatient, minimally invasive surgery called an ACL reconstruction. Delays to ACL reconstruction can actually result in early arthritis and further damage to the knee. In fact, our research team, including surgeons from several hospitals across the U.S., recently published a study finding that for each week surgery was delayed, young patients had a 2% increased risk of also developing a meniscus tear. So, how do we build a new ACL? One of the sayings pediatric orthopedic surgeons love is that children and teenagers are not just little adults. Because they have growing bones, surgical decisions should be made in a way to both optimize outcomes and prevent complications that could impact further growth. Standard adult ACL reconstructions have been found even in teenagers to carry a risk of interfering with growth, potentially resulting in unequal leg lengths or knee angular abnormalities. As a pediatric orthopedic surgeon, I carefully weigh 4 different techniques of ACL reconstruction, and each of these can have several modifications based on the specific patient. We consider bone size, remaining skeletal growth, and other associated injuries to create an individualized treatment plan for each young athlete. At Metro, we are fortunate to have a dedicated, multidisciplinary team to help our young athletes. This includes athletic trainers, pediatric physical therapists, physical medicine and rehabilitation physicians, and even specialized teams in the operating room, all working together to get young athletes of all levels back in the game. To learn more, visit metrohealth.org/orthopedics. Thank you.